There's a big advance in the treatment of a crippling hand disease. Lisa Malik joins us with more on how it helped a UP woman finally get a fix.
The condition we're talking about is Dupuytren's contracture, and the new treatment is a simple shot. When compared to the standard surgery, the recovery time is much quicker and the rate of recurrence lower. Carol Pfefferkorn loves to garden, but a not-so-little hand problem kept her hobby from growing.
Believe it or not, that little finger got in the way of many things.
Got in the way because this is how bent it became after years of dealing with a condition called Dupuytren's contracture, a tightening of tissue under the palm and fingers.
The fingers curl in to the point where you can no longer straighten them out, and patients have a hard time doing normal daily activities. They'll have a hard time putting their hand in a pocket. Their fingers get caught on things. It's socially embarrassing to go out and they can't shake hands because their fingers are in their palm. And they have a hard time grasping objects and so forth because they can't straighten out their fingers.
Surgery to take out the tissue is one treatment option.
About 15 years ago, I had the surgery because the finger head actually started to curl in, and it was very painful.
But within 2 years, Carol's finger was back to being as bent as it was before the surgery. That's why she was excited to hear about a brand new treatment just approved in February called Xiaflex.
It's an enzyme that goes in and it dissolves the collagen. We inject the patient one day, then they come back the following day and do a manipulation where we straighten out the finger.
Break the cord.
They have a splint that's made that they wear for about 4 months. And in the daytime, they're free to use their hand as tolerated.
With minimal recovery time, Carol's back getting both hands dirty in the garden.
I can use a wheelbarrow now. I like to garden. And I will start working with a keyboard. But it's just easier to grasp things. My hand is much more mobile than it was for a long time. I'm really happy with the results.
Dupuytren's contracture usually starts slowly. People will feel a little nodule, then it becomes a pit in the skin, and then moves to problems with finger extension. It's most common in people to start developing it in their 40s and really start noticing it in their 50s.